The Navigating PVS podcast is for general knowledge and does not constitute medical advice. Please consult with a qualified healthcare professional for any health concerns. I'm Joly. I'm here with Crystal Costante. Most PVS families have had a conversation about transplant, but Crystal and her son Nathan have lived it. I'm very excited to help you share your story. And yeah, thank you.
Thank you.
I think we'll just get started having you share a little bit about, where Nathan's story began.
Yeah. Nathan's story really just began at birth. He was postnatally diagnosed with supracardiac TAPVR. I didn't know. So he was born blue and he was literally whisked away. I didn't get to see him, didn't get to hold him. And then hours later, Sick Kids Hospital literally came to pick him up. He wasn't stable and they took him. And then a couple hours later, after giving birth, I got a phone call that he was put on ECMO and that they weren't fully sure of what it was. And then we found out that he had a heart condition.
Wow. So
Yeah,
many parents in this PVS world live through ECMO, but I feel like very few so early in those
yeah, it was
first few
literally
hours.
hours after birth. The first time I saw him, he was on ECMO, and the doctors, they try to prepare you for it. They try to describe the situation, and you don't really comprehend what that means and what that is to have a newborn baby, hours old, put on ECMO. And I almost passed out when I saw him. I remember months later, a mom reached out through Instagram and she's like, I remember seeing you and seeing him for the first time. And it was shocking just to see your baby in that vulnerable position for the very first time, not knowing what his future would be. But that's his story. And then it just developed from there and it just progressively got worse from there.
Yeah. When was Nathan diagnosed with PVS?
So Nathan was diagnosed with PVS after surgery. So he had his first surgery at 2 weeks old. They wanted to prolong it as long as they could because he was just so sick and so unwell, and they wanted him to just grow and to get stronger, but it wasn't happening. He was just getting worse and worse by the day. So they booked an emergency open heart surgery and they did a sutureless repair. And they kind of fixed him. And then after the surgery, he was intubated for a long time. I still haven't even held him at this point. He was over 20 days old for the first time that I actually was able to hold him. He was still intubated. They eventually maybe extubated him 3 weeks after his surgery, and he still wasn't breathing very well. And they put him on BiPAP. And BiPAP wasn't helping. So they're racking their brains trying to figure out what's going on. And then eventually they did more imaging and they did another ultrasound on the heart. I'll just say easier for people to understand.
Yep.
And that's when they saw it. They saw the PVS. And I just remember the moment right there. They pretty much gave us the diagnosis. And I thought it was really weird too, because they were congratulating the person who found it. So I'm like, why would they be doing that? This is so odd to me, but it's just it's a very rare thing. And I didn't understand that in the moment. And that's when our hearts just sunk, just hearing what it was.
How old is Nathan now?
Nathan is 7. So
this was set roughly 7 years ago.
This was roughly 7 years ago. So before he was 2 months old, he had 2 open heart surgeries.
And what was the original surgery for?
The original surgery was for supracardiac total anomalous pulmonary venous return. So his pulmonary veins were pretty much backwards.
Yep.
They were connected backwards. His body wasn't really oxygenating. He had an ASD, which kind of gave him some kind of relief and I believe that's how he was able to survive until Sick Kids rescued him. It's kind of amazing that a deformity could create something to help you stay alive for a little bit, but that's what he was born with, and it's a pretty critical form of heart disease too that he was diagnosed with, and no one knew. We didn't know.
Yeah. Very similar to us in that we didn't know until our daughter was born, and it really wasn't until we closed that large VSD and started repairing the PVS, then we triggered pulmonary hypertension, all the fun things, right? Because
Hmm.
the body is so resilient, right?
It
And
is.
create these like new collaterals, new paths,
Yeah.
and it will figure out workarounds. And so even though they're very sick, their bodies have figured out a way to keep them going.
Kids are just so resilient. I keep telling myself if this was somebody who was older, if this was me, there's no way.
Yeah.
There's no way. It's amazing what our bodies do, and it's amazing what his body has done to for him to be here 7 years later. Like, it's not a miracle. It's what the doctors and the team and everything has done to get him here. It's been a lot.
So you go back to back surgery, open heart surgeries before he's even 2 months old. He's already been on ECMO. Talk to
First
me.
time mom, first
Yeah.
time
Oh, okay.
parents.
Yeah,
Yep.
same. Yep. Yep.
Yeah, first time mom, first time parents, like not really knowing. We thought we had a healthy pregnancy and then we this happened. So,
In some ways more traumatic, right? Like you didn't get to have that normal experience of motherhood and parenthood, and but at the same time, sometimes I count that as a blessing, right? We didn't know any better. I wasn't constantly comparing my daughter to
yeah.
another child, right? So that I mean there's a little bit of a blessing in that, right?
I still don't compare him and I think he's just I don't know. I'm blessed because everything he does now, even like from the smallest little things that other parents might think is ridiculous and silly, I think it's incredible that he can do it. Every day is a win. Everything he does is a win and we celebrate it. So
Yep.
it makes it good.
Summer took 2 bites of applesauce at school on Tuesday, and you would have think we won the lottery around here. So,
Right? Right? That's I think that's the difference between like medical parents
yep.
and other parents is that like we get excited over these things and
Yeah.
he gets excited too. So,
The bar is lower for us.
but you know what? We celebrate it.
For sure.
Like we were told like Nathan shouldn't be here. He shouldn't be
Yeah.
walking, he shouldn't be talking, he shouldn't be doing the things that he's doing and he just doesn't stop talking some days and I just love it. So I'm blessed for it.
Summer is not talking yet, but that gives me tremendous hope. So thank you.
You definitely should have hope. So Nathan was diagnosed with autism as well when he was 3. So he was very much very nonverbal. And maybe only a few years ago did he start to put sentences together. So definitely don't give up hope and keep talking and keep treating her as if she's a normal developing child because it can come and he just doesn't stop talking. And it's just
I love it.
so beautiful. So hold on to that hope because it can happen.
It's been a good week. Like we were just talking before we turned on the recording, but it's been a busy week, very full of celebration, full of hope. Like
Yeah.
couple bites of applesauce at school. She said the number 8 last night. She pointed at the number 8 and she very clearly, articulately was like 8. So
Yeah.
like those are
It's
the
it's
wins. Yeah.
it's there. And when our children go through so much, they're going to be very much delayed compared to other children.
Yeah.
So
Yeah.
it's a win for us. And they slowly will catch up on their own. And she's only 4.
Yeah.
She's
Yep.
still so young and she
Yeah.
has a long way to go. And the more she's around kids in school, that
Yes.
it helps
For
big
sure.
time.
Yes, it
Big time.
does.
And she's your only child?
She's our only
She's
and
your only child. And I find
yeah.
that's more difficult too because
Yeah.
they're
Oh,
not
absolutely.
interacting with
Yep.
siblings, right?
Yes.
So there's a lot more on our plate. So
Yeah,
she'll
and
get there.
not to go into, US versus Canada, but where we live, we're very blessed. Like in a great program for 3-year-olds that not every school in the US has. And as you know, like no daycare's like waiting with their arms out. I
No, it's
mean, there's a
hard.
daycare shortage in this country. I don't know about Canada, but
Yep.
a huge daycare shortage in general. So if you have a medically fragile kid, it's that much more
difficult.
There's
Yeah.
no support, but he has more going on with him because of his transplant. There were complications that happened, and he has a trach, and he's
Okay.
nocturnally ventilated, and he has a G tube. So that means he requires care, and we can't put him into school without a nurse going with him, and he can't go to a regular daycare. So it's either on me or it's on nursing care, and obviously it's difficult to get government funding for that in Canada. So I'm sure it's difficult in the US as well. So there's a lot of support that's lacking.
Yeah. Yeah. Internationally.
Hmm.
And then add to it complexity is,
Yeah.
we haven't gone down the autism diagnosis path, but she was diagnosed with PTSD, abnormal stress response, like some of
Hmm.
those these kids experience a tremendous amount of medical trauma, and that space is not, it's a very nascent space. It has not fully developed with the amazing technology and ability to repair these heart conditions that didn't exist even, PVS wasn't even widely diagnosed. Like you said, the doctors are congratulating the person who found the PVS, and we think that too. We always think, okay, the doctor who saw it on echo when she was 3 months old, like, thank
Hmm.
you. But, I'm sure there's many children who go undiagnosed and don't have good outcomes. So you
Yeah.
you you mentioned the transplant word. I remember the first time transplant was mentioned to us, and we were evaluated a couple
Yeah.
times, and I think it's commonly discussed, especially with kids with severe
Hmm.
PVS. But can you recall back to that first conversation that
Yes, absolutely. I remember the very first time that word was brought up, and it was the second week of January. We went home.
just after this back-to-back surgeries?
Yeah,
And
so
he's
we went
4 months
home.
old.
He is, yeah. So we went home December 24th. So
Yeah.
we that's the first time we went home after the two surgeries, after knowing about the PVS. His veins were already starting to get stenosed again. So we went home, and then we were back 2 weeks later. He was just cold, he was blue, he was not doing very good, and the doctors knew he was going to come back. So
Yep.
we went back, they just took him to the ICU. Doctors already knew what was wrong. They already knew he needed a catheterization. They were just giving him some support. And it was late at night, and I just remember the doctor saying, like, this is normal. There's other things that he can do, and then transplants comes out of his mouth. And I'm just like, huh? Like, lung transplant? Like, what are you talking about? This is a heart problem. Like, why would you say that? That's a serious thing. And I remember that's the first time that word ever came into my mouth, and like my heart sunk again. And I'm like, it's gonna happen. Like, that's gonna be us. Because what else are they gonna do?
Hmm.
And it's so rare too to have a lung transplant for PVS. These are just some of the options that we can do, because the only other treatments that you have are Band-Aids,
Yeah.
catheterizations,
Yeah.
stents. That's all we can do, is just to support them, and hopefully they grow, and they grow big enough, and they grow out of it. But
Yeah.
that's very rare for that to happen.
Yeah.
So literally weeks after, he had another catheterization, and then we were just in and out every few weeks. He had to do the same thing over and over again. And then they wanted to try, maybe when he was a few more months old, drug-eluting stents.
Yep.
And that didn't work. He also was trying, we weren't part of a clinical trial, but we were trying the drug that they were using for the clinical trial, which is, I believe it was losartan, and it wasn't really affecting Nathan. We were still in the exact same point. We were still doing the same things. And then I remember, I think he was like 8 months old, we were going for a checkup. We just finished having a heart catheterization, and then his cardiologist, like, there's nothing else we can do. I think we should evaluate for a lung transplant. And I was just like, so soon? Like, right now? Like, he's 8 months old.
Wow.
And there was nothing further they can do. They can't take out the stents. They don't want to risk taking out the stents. They don't want to risk doing anything else, because what's going to be his quality of life? It's just going to make him worse. It's going to keep him in the hospital longer. he just needs to be a little boy and you just need to love him. And this is an option I'm giving you, is let's see if we can get him listed for a double lung transplant this young.
I remember the first time we had the conversation, and it was like, well, how many of these get performed, right? And the number is so small. Like,
That's the first question I asked, actually.
yeah,
It was the first question I asked, is how many transplants, infant transplants, have you guys done? And Nathan was the seventh. And how many transplants for PVS as an infant? And Nathan was the first.
yeah, yeah.
So
I think I know of one other, and it's limited by who's willing to be out on social media and sharing, right? But I think I only know of Nathan and one other kiddo that had it done at Texas Children's, I think.
I know of a Texas one as
No,
well.
I know it's not very common. Lung transplant is not very common, even in adults.
No.
Ours was a pretty quick no. Summer got denied because she had too many antibodies. They had used cadaver tissue to close her VSD, and that pretty much knocked her out of the running. And she had had quite a few blood transfusions at that time. So tell me about the process of being evaluated for transplant.
So the process for us is really quick. They wanted to get it done. They wanted to get him on the list because,
Sorry, I want to ask you for a question
yes,
before the process. You ask your question, you're like, how many of these were done? What got you to say yes, will be evaluated? And did you say yes to being evaluated, not fully committing yourself to this idea?
I was, see, I did ask. I asked, can I say no? Can I go through this process and can I just say no if I get the call? And yes, you can, but you're also delaying the process for someone else as well. So you need to be sure, you need to
Yeah.
be certain, and they evaluate you to make
Yeah.
sure you are certain, because the whole part of this is psychological, right? You need to
Yes.
have the inner strength to do this. If you don't, you won't be put on the list for it. So
I
like
remember them saying to us too, like, transplant isn't a cure.
it's not. You're trading a death sentence for something more manageable and something we know a bit more about, right?
Yep.
And that was like my option at that point. It's just really bad to say, like, do I want my son to die or do I want to give him a chance? That was my option. And I didn't want to watch him die. So I had it in my head is that we're doing this. We're going through the process of a transplant. They said it was very rare anyway, and the possibility of it happening is probably not going to happen. So we're going to do it. I was full force. I wanted to give him the opportunity. He was already showing that he was a fighter being alive from what he went through. And what I think I struggled with too was like, did I make the right decision? Because this is a decision that's going to affect the rest of his life. Transplant is not a cure. There's things you have to do to keep those organs alive, and just to be respectful that those are somebody else's organs. Another person died. We have to teach him to respect that and to keep his body healthy. So there was so much going through my mind at that point, but I knew I wanted to give him a fighting chance. So I knew at that point that I was going to do it. I wasn't even thinking about it, and I didn't even have time to think about it. From the time that like he was listed to he had his transplant was 7 days.
Oh, wow.
Yeah, so this was like a really fast process for it. I
That's
think,
highly unusual, right?
yes. That was when I'm telling you, like, our story is completely unusual and it was shocking to everybody. And it was a big thing in the hospital too. Word got around that there's a little kid who was listed, and they all know him because they knew him from the day he was born, and he was constantly in the hospital. But we were listed for 7 days, completely unheard of. How does that happen? But it was a quick process. So when they wanted to do transplant, they needed to do everything quick. We had to do all the testing. so much imaging, so much blood work. They had to evaluate me as a mom. They had to evaluate me as my support and how I'm going to help my son if I'm capable of doing this, if I'm capable of doing this, if anything goes wrong. They need to make sure about it. And they had to do that fast because his body was building antibodies. And
Yep.
we were right at the limit right there.
Okay. Okay.
We were at the limit because he was
Well, because
like,
he's had transfusions. He's had
multiple transfusions, and I think he was like 9 months old at this point. So he was at the limit. We did it fast. I kind of hesitated and I wanted to wait, and then I'm like, no, I'm gonna cancel life. And we did everything in a week. We got all the imaging. Wow. I'm about an hour away, and it can be up to 2 hours in traffic from sick kids. And I would drive there every day for hours every day to do everything that they needed so that they can list him, because I just had this urge that we need to do this now.
It was like that instinct just kicked in.
It's an instant. It kicked in. I'm like, no, they are supporting this and they're saying that this is his best chance. And we have such a short time to do this the proper way and to do this the right way that we need to get it done now and get him listed. The faster I get him listed, maybe the quicker. And he was the only one on the list for his age, and he was top of the list for his age. But it's still pretty rare if you think about it. 10-month-old baby. Like, what do we need?
Whose lungs are healthy enough to...
Whose lungs are healthy enough. And somebody has to lose their baby to give my baby life. And that's a rare thing too. If you were to ask me if I would have my son be an organ donor, hell no at that point. You know, I want to hold my son for his last breath. I don't want to give it to somebody else, right? And obviously my mind is completely changed now, and I understand the importance of it, but I understand why it's so rare and why people don't want to do it, especially when it comes to like a little baby.
Do you, looking back, do you think that the speed of which things transpired helped or made it more traumatic for you?
I think it helped because I didn't have time to absorb and to process and to feel. I was still numb from the day that he was born. I'm probably still numb right now. It's been a long, long journey, but I'm kind of grateful that I didn't have that time, and I was just able to focus. I was able to focus on him and getting him where he needed to be, and not having to wait so long, waiting, am I going to get the call? Is the call coming today? And that anxiety and that stress. I'm kind of grateful that it was so fast and so quick. People can wait years.
When these kids are really, really sick, they don't have years, right? Like time is so important, so critical. We're very lucky that, you know, we had the teams that we did that were able, once we got that initial no, Summer was evaluated twice. Once was for the lungs, and then as her right ventricle started to get sicker and sicker, she was evaluated again for heart and lung. So there's a process called apheresis, which basically cleans antibodies out of your blood. And when you're doing a heart transplant, you can have a higher threshold of antibodies. So at that point, they reevaluated her. But by then, she had many more blood transfusions. So even though she was too high for the lung cutoff, and then by the time it came around to do heart and lung evaluation, she was too high for that higher cutoff. So, you know, you're absolutely right that, you know, you making that swift decision was so critical in his ability to accept these lungs. And I think Summer wasn't quite sick enough yet, but I think her team in Boston knew it was coming. And I think we just weren't ready to have that conversation.
I think they know Boston is, besides sick kids, like Boston is where I would go for this kind of treatment. I think they're well educated in it and they're quite knowledgeable. They do things completely different as well, but there's just so many different treatment options, as I should say, that they have for it. And it's so important to do especially with the lungs. They're just such a big organ, and they're exposed to the outside environment, right?
Yeah.
What we breathe in, everything we breathe in can affect the internal organ, and that's what just makes them not such a good organ to transplant. So you definitely want to be able to put them at the peak moment inside the body to make them last longer, because it's not uncommon to have to retransplant lungs, and I'm not sure if I would want to go through this whole process again. And there's rejection you have to think about. I think it's more common to have a rejection with lung transplants, whether it's acute or rather it's chronic. And Nathan went through a little bout of rejection, and thankfully we were able to settle that, but it happens, and it's a lot common with the lungs. They're huge.
Yeah.
The huge organ.
Yeah. Tell me about the surgery itself. Like, that's a long day.
And that was a long day. I remember we got the call the night before at like 7 p.m.
Was he
and
inpatient or at home with you?
he was at home.
Okay.
He was at home. We got a call and they kind of played it down because it happened so quickly, right? They're like, don't lead on to these parents. They call it a dry run, right? You come in and they tell you that the organ wasn't suitable and you go back home. So they let us on that it's probably most likely a dry one, but bring him in anyway so we can evaluate him. So they're like we went in, they were getting him ready. And I'm like, why are we doing all this stuff if it's a dry run? And I haven't seen a doctor yet. I've only seen nurses, and they're onto something that we don't know. And then hours later, the doctor comes and he says the lungs are good. We want to go through with it. We want to do the transplant. So in the wee hours of the middle of the night, they took him. They put him in through surgery. I remember walking him down the hallway and handing my 10-month-old into the arms of a nurse, and like not knowing if that was going to be it. That was going to be the last time I ever saw him. And sat in a waiting room for 14 hours. I didn't move. I don't even think I went to the bathroom. I don't even remember time going by. I just remember doctors coming out looking completely exhausted. And it was done. The transplant was done, and he was being put into the ICU. They said it went smoothly. I'm not sure if it really did. He's just a tiny body. There's a lot of scar tissue in there. That was 14 hours. That's a long time. And then they were having trouble stabilizing him when he came back, which is normal. It's a little body, right? And it was just, it was a hard moment. It was a hard moment just seeing him for the first time after surgery, not sleeping for over 24 hours, just not knowing and waiting to hear feedback and news. Like, your son just went through a huge surgery. And again, you walk through the hallways and they're congratulating you. And it's like, this is so weird. Why are you congratulating me? Like, what they don't prep you for is another baby died. I don't want to be congratulated for somebody else's loss.
Yeah.
That's something that I really carry with me to this day, is that somebody else lost their baby so that mine can be here today. And I understand why they're saying congratulations, but I always felt uncomfortable with it. But it was a really long day. It was a long day. I was tired. And you don't know after that point, right? You don't know how much time you're going to be there. You don't know what the next steps are. You just need to see if he wakes up and if he's going to breathe on his own. And that's when it kind of all spiraled from there. So like normally at that point, they'd be breathing on their own. We'd go home. And then we would start the journey of learning how we take care of this new boy who's got transplanted lungs. But he had complications, and there's complications with every surgery. Like, the worst is death, or we got the others, and his phrenic nerves were damaged during surgery. And you need those. You need your diaphragm. It's your main muscle to help you breathe. So he wasn't able to breathe without a ventilator, without support. And he was supported on a ventilator until mid-September, until we decided to give him a tracheostomy, because we could no longer watch him be sedated and be intubated. We needed him to wake up and to move around and to grow and to develop. Even though he couldn't breathe on his own, we would figure out how to live life with a tracheostomy and a ventilator at home if we had to.
Did they discuss that as at all as like a possibility post-transplant, or was this
It's kind of
very...
it's kind of a discussion, it's a risk, right?
Yeah.
We don't know that phrenic nerves are going to be damaged, or you don't know, but it's a risk that you can be put on a tracheostomy. Like, you sign off, when you sign off paperwork, they give you all these risks.
Yeah.
They really didn't even have to tell me that he needed a tracheostomy. I knew, and I kind of pushed for it. Like, something is wrong. They're doing all this testing. They see the phrenic nerves are damaged. And like, I knew as a mom right then and there that this is trouble. So this is long term, this is time, and it's not there. We can't live like this with the ventilator. So I knew it was coming in the future. And I don't think I've cried so hard in my whole entire life, just knowing he needed a tracheostomy. And it's just so stupid because I wouldn't hear his first laughs. I wouldn't hear his voice. I wouldn't hear these little things because of this trach. And it was just like such a stupid thing to me. And I just remember bawling my eyes out. And I had been so strong at this point, and the doctors knew I was so strong at this point. And I think it's just the first time they ever just saw me so vulnerable. And I couldn't keep in my feelings. And they haven't even told me yet. And I already knew. Like, I already knew it was coming, and I just wanted it done, and I wanted it over and done with. And they wanted to wait.
I feel like it was this culmination of everything, right? It
Yeah.
was like you got through the transplant, you're so strong, and they're doing all these things, and then it's like, this is the thing that just kind of tipped you over.
Yeah, this was like the thing that tips me over. I'm like, is this it? Is this like the worst thing that's gonna happen now? I have to give this up too? And it was just like, I broke at that point. And I remember just feeling so hopeless. And I just felt it. And I felt it for a bit, and I processed it. And then I was ready to move on, and I was ready to learn, and I was ready to know about it, and I was ready to get hands on, and I just wanted to have his tracheostomy, and I just wanted to get him home.
Yeah. Yeah.
After that, we were there for about a year in the ICU.
From
Yeah.
the day of transplant surgery.
From the day of transplant surgery, we were there. We were in the ICU, and near the end, COVID happened. Like, lockdown COVID, full thick COVID. And it's like, that just made my life so much more difficult, right? And so more fearful.
Yes, I was gonna say the anxiety. I can only
Like, the
imagine.
anxiety. The day lockdown happened is the day we were discharged, and I was just like so grateful I could go home. And we were discharged with the tracheostomy, with the ventilator, with all of this that I had to manage at home, and I didn't care. I wanted to go home. And they wanted us to go to like a rehabilitation center, and I was just having none of it. After a year in the ICU, I was having none of it. I already knew what I had to do. I was one of those moms that was there. It's like, I want to go home and lock myself up. He's had a lung transplant. Like, I don't want that. It's devastating. So we were there a long time. I'm still exhausted, and I'm still recovering from it, and I'm still feeling the effects from it, even though here we are 7 years later. It's still difficult.
Yeah. By the time he got discharged with the transplant and the trach, he's almost 2.
He was almost 2. Yeah. We spent his first birthday, our first Christmas in the hospital.
Summer's first birthday was also in the cardiac ICU.
And you know what? I'll give it to them again. I'll give them any Christmas they want. I'll give them any birthday they want. As long as my boy comes home, they can have it, right? It just doesn't become that important. And I was just happy to have him home, and we had to learn this new way of living and learning how do I raise a almost 2-year-old to be a 2-year-old with all these medical devices. I want him to learn how to walk. I eventually want him to learn how to talk, but how do we navigate this and how do we do this? And I figured it out. And eventually obviously he's 7 and he still has his trach, but he only uses his ventilator at night and he doesn't need huge amounts of supports that he needed then, unless he's obviously sick.
Yep.
And I'm grateful I still have that stuff at home because I can support him as if he was in the ICU in his own bedroom. I don't have to go there every single time. But this is the extreme transplant. It's not supposed to happen this way, right? You're supposed to have your transplant and then you're supposed to just have to watch for, your medication levels, make sure that they're leveled out and make sure that there's no rejection and keep yourself healthy and get your flu shots, get your RSV shots, stay away from sick people. And that's how it should be.
You mentioned earlier that Nathan had a little bit of rejection.
Yes.
Can you tell me about that?
So that was right after lockdown, right after everybody was able to go back to school. It was his first time going to school.
And how old is he at this point?
I think how old is he? He's just almost 4.
Okay.
He's almost 4. So it's his first time going to school, terrified, because obviously germs.
Yep.
Like knowing, and like we were all just coming fresh off of lockdown.
Yeah.
And that's kind of like the worst time to go back to school because now everything is coming out and everything is just 10 times worse. And kids are getting sick with absolutely everything that they haven't been sick with. And Nathan just kept getting
the flu, the RSV, there's no normal seasonality to it.
He got everything and he just kept getting things that doctors are like, where are you getting this from? It just doesn't make sense. So he just kept on getting sick. And then it was like we were having a conversation, like, what is the safest thing to do at this point? Do I pull him during cold and flu season? Do I completely pull him from school? So we made the decision. I pulled him from school because the risk was it was too much. And he just wasn't getting better. Like at that point, he was only on his ventilator at nighttime. He didn't need any oxygen, but when that last point that he had got sick, he was needing his ventilator intermittently throughout the day. His oxygen levels were still kind of low and he needed support, and even time wasn't helping. And we're like, what's going on? So we decided to do a bronchoscopy. We decided to do a biopsy, and they noted that there was some rejection. And they're telling me not to worry about it. It's normal. And I'm like, you're telling me not to worry about rejection.
Like, you're using the R word. Like, why?
Like, that's the R word. And there's different levels of it. And I'm like, I don't care what level it is. Rejection is rejection, and it can turn into a higher level. Like, this scares me. So we had to go and get treatment through Sick Kids. We did it outpatient. I just had to go every day for, I think, 5 days. And so he could get hours of IV, and he's been fine since then. And I've just learned to be a bit more cautious during cold and flu season. I'm sure his school thinks I'm crazy when I'm calling, that kid that was there yesterday, are they there today with the flu symptoms and with a fever? Because I'm going to pull my kid. He's home today because there was an illness in the class the other day. And I'm like, yeah, I'm not gonna send him.
Yep.
You just have to be extra cautious. But honestly, the more he grows, the bigger he gets, the less that happens.
Yeah.
The more resilient that his body becomes, even though he's immunocompromised. And when he can get sick, he gets really sick. It's a lot less admissions compared to a few years ago where I would be there 3 or 4 times a year for a few weeks at a time. And I'm not going to say how long it's been since we've been admitted, because we don't talk about that. But it gets longer and longer as you go. But rejection's a huge fear right now. And I think it's always going to be a huge fear. And it's not just about not getting sick. It's about taking your medication, taking the right medication. Make sure you take it at the same time every day, because no one tells you about that. Transplant comes along with a lot of medications that you have to take, and you have to take them at certain times a day.
Yeah.
And you have to go and get that blood work checked monthly or every 2 months to make sure that those levels are okay, so that your body doesn't think that there's a foreign object inside your body and start attacking it.
Yeah, like
So,
a lot of kids with PVS, Summer is on sirolimus. I assume tacrolimus
yep,
or for Nathan. But it's a lower dose, but like still you have that immune compromise piece of it. And yeah, the timing, has there been a day every few months where I'm like, oh my God, it's 11:20 and we forgot to give her the zero. Like,
yeah.
but no, nothing will put you in a panic like that. We didn't specifically touch on this, but no more signs of PVS since the transplant?
There hasn't been, no.
Okay.
And all we have are, again, we traded something else
Or,
for something more
yep,
manageable,
yep,
because it's not a cure, but we know a lot more about transplants. We know how to manage them, and we know how to treat them. Whereas PVS, we don't. So we traded his death sentence for another thing, which I'm grateful for. I'm grateful we had the opportunity and the chance to do something like this, because I'm not sure we'd be having the same conversation today,
yep,
if we didn't. I don't think he would have made it to the 1 year mark.
yeah.
He was pretty sick.
I know at least a couple of parents who've gone on to have other kiddos. You mentioned
Mhm.
Nathan's not your only.
He
I
is
think
my only,
he is
and
your only.
he's my
Okay.
only, and he will be my only.
Yeah, no, I'm like, yep,
Yeah, many reasons why, but I also think I don't think it would be fair to another child to bring in with his complexity. I don't have the energy for another one.
no, I mean,
I can't do this again. I'm happy with one child.
yeah,
I think that was going to be the case either way anyway.
it's kind of funny now, but it took a little bit for this to be funny to me. But I had an emergency C-section. Summer was breech. My water broke 3 weeks early. And I remember at the last minute, they're like, do you want us to tie your tubes when we're done? And my
Yes,
husband and I are
please.
like,
That's just a question. That's a
like
weird question to ask.
in hindsight, I wish I would have said yes. But at the
Yeah.
time, we didn't know all these things about Summer. And we're like, well, no, not yet. And I always joke, like, once we got the PVS diagnosis, I'm like, definitely should have said yes, because this is such a difficult journey. I find I'm in awe of the parents who go on to have
Me too.
children after a PVS diagnosis, because
Me too.
wow, how brave. I mean, not that our choices are any less brave because we've chosen not to continue to have children, but I don't think I have it in me to, like, the risk of
No.
having to go through this type of journey again.
It's the fear of, like, is this gonna happen again? They say it's not genetic.
Yeah,
But it's exhausting.
it's exhausting.
It's just exhausting. And I don't think I can mentally take it on. And I don't think it's fair to Nathan. You don't have to have, but I just
Yeah,
don't know. I don't, kudos to them. Like,
yeah,
they're
yeah.
resilient, they're strong. And I wish I had that kind of energy, that they could go through it and then manage medical and non-medical and just do it so seamlessly. Like, I'm not built for that.
Nope, nope.
I'm still trying to get through and process my journey, and I'm
Mhm.
still trying to heal from mine, because it was so traumatic, and I know I'm not okay, and
Yeah,
that's okay, and I can admit it, and
yep.
I can seek help when I need it, because I do suffer from PTSD. I do
Mhm.
suffer from all these things, and I feel these things when he gets sick and when we have to go to the hospital. That's when I have my
Mhm.
breakdowns, and I can feel it. And the great thing about the hospital is that they know it. They
Yep,
know what my triggers are, and they know
yep.
what makes me feel better, and they know me coming in really will get to me, and they know I will not leave my child, even though you're not allowed to like fully stay overnight in the ICU with my child. They know they'll have to rip me out with security guards and police officers, but that's not going to happen. So they bend rules a little bit for people and for families like me, but no way I can have another kid.
No,
I'm not healed.
no.
I'm not healed. I'm
No.
not sure I will ever be healed. The only thing that's important is that Nathan doesn't realize what he's been through.
Yeah.
He is only concerned about Super Mario and playing with toys, and that's the only thing that matters to me, is that he can feel that and not feel what he went through over the last few years.
Yeah. We kind of touched on this, but the appointments with specialists and all the developmental therapies and
Oh,
it's
it's
exhausting.
exhausting. It's exhausting. And to be like quite honest, I feel like children like your child and like my child, they need the support for their development. They are behind. They've been through a lot. They're going to be delayed. It's going to take a long time for them to catch up. And just the lack of support that we have in Canada for it, especially when they become school age, there's nothing. It just all disappears. And this is the time that really, really counts. And especially Nathan has an autism diagnosis.
Yeah.
And I can't really get the support that I need. It takes you're on waiting lists for years.
Yeah.
This is the time that matters. If we want them to be, you know, amazing individuals. And he's so smart too. And
Yeah.
I just want to be able to support that, because he's going to go on and do incredible things when he's older. And I just want to be able to support that for him now. And it's just, that's on me. I have to do everything. And that's just another level of exhaustion that is put onto me, besides me going back to school for some crazy reason. That's another level of exhaustion that I have. And we're burnt out. We learn how to work burnt out, and we learn how to live burnt out. And it's just
Yeah.
become normal to us.
Yeah. I know you're active in social media too. There's so much out there about non-medical parents. When we say we're tired, it's like on like a cellular level. Like
Yes.
it's like in my soul, I am tired. Like
Yeah.
it's not, I didn't get enough sleep for the last 4 years. It's that, and just navigating these systems that aren't intended to
Yeah.
support complex kids. I can't tell you how refreshing it is as an American to hear a Canadian saying some of the things that we talk about in the US all the time. But you just mentioned it. I think we talked about it before I turned on the recording. You are actually the second PVS mom that I know that went back to school for nursing. And
Really?
I was yeah. And I actually
Oh,
think there's probably a few more out there.
there
And
probably is. You know what it is?
it's so cool. It's so
It's
cool.
crazy. And it's not because like it's something like I've always wanted to do just as a little girl. It's not because Nathan motivated me, but I see that there is so much that is missing in that profession, just being on the inside of it. And I don't know what I'm going to be able to do to change it, but I need to be able to try something, because
Yeah.
doing this as a mom is not working. And there's so many things that can be done differently. And I just feel like it's my calling. It's something I've always wanted to do, and I'm exhausted, but I'm getting through it. So it's an exciting a new thing. And I think we're lacking a lot of pediatric care, especially when it comes to home care,
Yeah.
because
Yeah.
it's a very difficult, I'm so blessed with the amount of care that I have, but I know there's a lot of families that are lacking, and I just want to be able to help with that.
Yeah.
I want to be able to support with that and fill that kind of gap. And selfishly, I need to learn a bit more so that when Nathan gets older, I can advocate for him
Yeah.
and be there for him, and to keep my brain fresh and to understand a little bit more, because I've done all I can do as a mom.
Yeah.
And it's also time for me to kind of branch out. And being a nursing student, God bless all the nurses out there, because
Mhm.
it's difficult.
Yeah.
It's hard. It's hard. So it adds
I
another level of respect for them.
Yeah, and bringing the empathy that you have built, having gone on this journey and being able to bring that into your practice as a nurse is going to be so amazing. Kudos to you. And I was saying, I feel it definitely feels like something, I don't know. It's like we all have a little bit of imposter syndrome, right?
Yes.
Like when we are in medical facilities, I can't tell you the number of times, and I'm sure this has happened to you, and I see people in the medical community talk about it. The number of times somebody's like, "Are you from the medical profession?"
Yeah, we
And
know a
you're
lot.
like, "Well, no, but yes." Like,
But it's not like it's they don't even like push you aside too. I find like, I don't know, with sick kids and with all of Nathan's team, they welcome you because
yeah,
you know more than them when it
yeah,
comes to your child, right?
yes, yes, yes.
You know a lot about it. And they come to me for advice, and I do a lot with sick kids and with the team and with their doctors. Like, I'd love to advocate and I'd love to help other families, and I love to help them figure out how to be home with their trach and vented kid, and how did you get your kid to walk, like how to help other families with the simplest little things, because the doctors and the nurses and the team don't know that. They don't know how to take all of that and put it into the home and how to make it work. It
How to
comes from,
navigate all these durable
yes,
medical equipment supply
yeah,
companies, and yep,
yeah,
yep,
like how do you navigate getting cheaper supplies,
yep,
right?
yep.
Like, they don't know there's a huge community out there, and we hoard our supplies, and we want to trade, and we want to share,
Yep.
and we want to give. And this is just how it is. It's completely different from the hospital than it is from home. So they're very open to listening to moms and dads and caregivers nowadays, which I find is very lovely. I feel a part of the team sometimes, and
Yeah.
it's just makes the care that much better.
For sure. For sure. I think in our experience, the academic facilities have been by and large the best experience for us. Just because, especially with these, and I assume Sick Kids is a teaching hospital. Boston's a teaching hospital. Lurie Children's in Chicago is a teaching hospital.
Yeah.
We transferred locally to the University of Minnesota's pediatric teaching hospital. And just those facilities, particularly when you have these rare diseases like PVS, those are the those are the facilities that I think are willing to dig a little bit deeper and try to uncover those rocks. And they're hungry for learning, and they're
Hmm.
giving each other high fives for making a diagnosis that might go unseen, right? Like,
As they should, because it is incredible to be able to diagnose something like this. If I take off my mom face and I just think of it that way, like, what an honor would it be to be able to see something like that and to diagnose that.
yeah.
I take no offense when they congratulate each other. I will congratulate them now too.
Yeah.
But in the moment, you
Not the right
don't,
place in the moment, but
not the
yes.
right place in the moment. I didn't realize it in the moment. It was, but yeah, yeah,
Yeah.
you need to see it in order to be able to make a difference and to make a change. It needs to happen. Things need to progress. Like, if PVS didn't happen, if it didn't hurt children, if it didn't go to the extreme, what would we be doing medically for them?
Yeah. Yeah.
We wouldn't be researching trying to save their lives. So
Yeah.
there's definitely a difference from there was years ago to now. There's not enough, but there's little progress, and it's kind of cool to see how it's coming along.
Yeah.
Especially like in the world of just like lung transplant and any organ transplant. There's so much that has been done in like the small amount of time that Nathan has been alive, that we hope for his future.
For
Maybe one
sure.
day he won't have to take immunosuppressants.
Yeah. My husband's a type 1 diabetic, and they're doing some amazing things with like isolate transplants so that you can get your pancreas to essentially start creating insulin again. So,
Wow.
and they're using some new anti-rejection drugs that are not as harsh as some of the things that probably Nathan's taking. So,
Yeah. They
yeah,
actually, not to cut you off, they have an
yeah,
effect on your body. He's been on them for years, and they've taken a huge effect on his body. So Nathan is 7, but he's the size of a 4-year-old.
Okay.
So it's affected his growth, it's affected his development, it's affected his bones. So
Yeah.
being on those drugs, they're not good for you for long term. It hurts your body. It deteriorates them. But we have no choice at this point but to be on them. And maybe one day he won't have to. And we're lucky that he's on such low doses, but just read the side effects of one of the medications
Yeah.
he's on, and it's like, I wouldn't want to take that.
No.
I wouldn't want to take that.
What would you say if a parent was, they're sitting there today and they're having their conversation with their team? Hey, the PVS is aggressive. We're not winning. We want to talk about lung transplant. What would you tell them?
I would say that obviously it's a very personal decision, and it's a very difficult decision to make. And you have to be willing to support it, even if it's in the extreme, like in my end. If you're going to go through it, you need to be fully committed. And I'm grateful that I went through it, and I'm grateful that Nathan is here today. Even though it's been a difficult journey, it's been a very rewarding journey. And it's been even more rewarding for me than it probably would be for any non-medical family, because I get to view the world in a different way with him. And I would say do it if you feel that you can do it. And I would say it's hard and it's not easy. And there's going to be days where you are just not going to want to go on, but you just need to feel it, process it, and then pick yourself back up and just do it, because it's worth it. It's your child.
So that wraps my conversation with Crystal. Thank you so much for sharing this incredibly important story about lung transplant in the PVS community. I know it's a conversation many of us need to have with our children's providers, and I think this conversation is going to help so many people. So thank you again, Crystal. I look forward to publishing new episodes, we'll say relatively soon. Thanks for listening.